Joining us now on the phone from Nairobi to discuss the issues, Dr. Boniface Chitayi, Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union. Dr. Chitayi, welcome to In Focus.
Thank you very much.
Yes, first just give me a sense of what is the government's response up to this moment as we speak?
Up to now, the government response has not been forthcoming because the talks collapsed on 2nd of December, and since then there's been no response from the government. There's been no contact between the union and the government, and therefore the talks have stalled, and the doctor strike is going on across the country.
Yes, you did give a warning that you're going to go on strike when those talks collapsed. What really in those talks could not go through? What is it that you could not agree on?
Okay, the doctors gave a strike notice much earlier on 19th, 7 days longer than a normal strike notice should be. And we went into 2 weeks of negotiations, but the negotiations were stalled. There was no goodwill on the side of the government and willingness to sit ground on the side of government. And therefore, we went into a situation where we could not agree. By the time the talks ended, we had not agreed on how the situation of healthcare in Kenya can be improved, how the declining standards can be reversed. We had a 13-point proposal that proposes on how healthcare in Kenya can be improved in terms of constructing of more facilities, equipping the hospitals that we have in Kenya, and employing more doctors and reversing the trends of doctors leaving the country for other countries.
Now, Dr. Chitayi, there's a question of the reality of the economy of the country. 300% increase your demand and all the other structural things that have to be implemented. Can the government accomplish that in the short term?
The government can accomplish this in the short term because the budgetary allocation to healthcare in Kenya is 5.5%. And if you look at the Abuja Declaration of 2001, Kenya was one of the countries in Africa which signed a treaty, signed the declaration in which the healthcare budget of these African countries was supposed to take up 15%. And currently in Kenya is only 5.5%. What the doctors are asking that can be used to remedy this situation is only 0.5% of the budget, and therefore, and for the healthcare system to be improved, it's only 10% of the budget.
Okay.
And therefore, in the medium term, if the government can allocate 10% of the budget to healthcare, then we can be able to solve many of these problems.
Well, thank you, Dr. Chitayi. Thank you very much for joining us today. We'll be coming to you in the coming days. That's Dr. Boniface Chitayi. He's the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union.